And what about your diabetes? How was the
Yeah, that's what I
diabetes
was gonna
control?
ask you. I've been checking it. So, like in Canada, I never checked it, right?
Okay.
So it
So
was
how was it?
okay. So I've been checking it every day, and
Uh-huh.
it's actually surprisingly is low, like 95, 90.
Uh-huh.
Even yesterday was 67.
Yeah. This MGB is very strong tool against diabetes. So most of the times when you check, it will be like this only.
Okay, but is that something to worry about when it gets
No,
to
no, nothing to
67?
worry. No, no, no. If you feel, if it's too low for your bodies, then you'll feel it. There'll be tachycardia, pulse,
Sweating.
yeah, palpitations, and then sweating, and then feeling of, being low. And that thing is it's very evident. You can make out very easily that the.
Yeah, I was very
sugar
surprised. I
comes
thought
down.
once I lose the weight, then the diabetes comes under control.
No, 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 no.
I didn't understand that.
This used to be the concept earlier, actually. Even other medical doctors used to think like that diabetes goes away with weight loss. But actually, it's not like that. It goes away right from day one. That's what we see in most of the patients. The reason
I
is
was surprised.
now the food is going down, 6 feet down. So it's touching a new point on the intestine. So that's the reason. That new point acts as a new sensor. So it can sense your sugar in the food in a much better way. So rather, the situation becomes a little bit ironical. If you take a lot of sugars, after 20 minutes your sugar will go further
That's
down.
what I was.
Yeah.
We were wondering, my wife and I and my father-in-law, like,
Yeah,
how could you? Sugar is supposed to raise sugar, right? But how could that?
that's because it's very simple to understand actually. What has happened over this period of 35 years, that your intestine has become insensitive to the sugars and carbohydrates which you were eating. Once you eat something, say you have taken a lot of sugars, you put some 2 teaspoonfuls in tea or coffee, and it'll come into the stomach, and after that there is duodenum. Duodenum is the first part of the intestine. So always in these last 39 years, every day, your food has been getting out of the stomach and touching the first part of the intestine, the D1, duodenum. And that was the part which was sending signals to pancreas.
Okay.
And every day it was touching that point. So over a period of time, that point becomes insensitive. So it's not sending proper signals to the pancreas. It's not that your pancreas was not good. Your pancreas was all healthy, it was working well, but it was not getting proper orders to produce insulin. And now that your food is going down, 6 feet down, and it's touching a new point. Earlier it was touching here, now it's going here. And this is the new point on the intestine where fresh food had never gone earlier. Because earlier food would take 6 feet, would have to go through 6 feet to
go down.
reach that point. And while traveling these 6 feet, all the blood sugar and fat got absorbed into the blood. So this point could not find any sugars in the blood at that time, in the
Oh, I
food.
see. Okay.
Yeah.
Oh, wow.
Because by going 6 feet down, all the sugar is already, out of the food,
Exactly.
into the blood.
So there's nothing going
So
there.
that point, was not habitual to see high blood sugar in the food. This is a
Wow.
simple, common concept to understand
No, now I understand.
how
Before
gastric bypass, cures diabetes.
Before I couldn't understand. Like,
Yes.
it was.
Yeah.
They're saying don't have a sugar because your sugar
Doctor, do you
will.
think you'll ever need to take metformin or no?
Mostly we see he was not on insulin and his diabetes was not that bad. So in such a case, we think that he might not have to take it again anytime in his life, unless he gains weight. I have seen everything because it has been like now it's my 10th year into this field. So I have seen patients coming back with diabetes also. 4 or 5 patients out of 100 might have it back. So when that happens, once you start gaining weight,
And your lifestyle too, right?
Yeah.
Your eating.
if
style.
you are eating badly, but still it works well for at least for 7-8 years, still it works well. But
No, I think.
after some time, again that point can become insensitive. If every day we are trying to punish it, it
Exactly.
might become insensitive over a period of time, and if it becomes insensitive, then sugar can come back. But the thing is, even if it comes back, then it will further take 10 years to reach this level?
That level was
How old was your diabetes?
2005.
2005, so about 11 years. So still it will take 11 years to come to this point. So earlier the medical doctors did not used to believe this. Earlier the belief was that just with weight loss,
Exactly.
you get control on your blood sugar.
That's what I
But,
thought.
but we have checked this, we have documented this, published this in many of the international journals, and even such kind of studies have come from many other corners of the world as well. That what happens is because of the new point on the intestine, better signals going to pancreas. Same pancreas produces more insulin in the first hour after food. So insulin, it's a kind of insulin pump, now you can say. You take food, pancreas produces insulin, insulin levels go up. We have checked insulin levels also. In the first hour after food, your levels after surgery are higher than what they were before surgery. So what that shows? Pancreas is producing more insulin.
Yeah.
So how is it doing? Doesn't matter. How is it doing? But we know it's doing it. The reason could be many hormones which are produced in the intestine which send signals to the pancreas. But I am telling this in a layman's language that it's sending better signals. Those signals are actually hormones, different types of hormones. So after some time, again, the insulin levels go down and become normal.